Well, hello, everyone, and welcome. It's so great to have so many of you joining us. I'm Sharon Caddy, and I am going to be your host and moderator for this very exciting virtual fundraising event for Amref Health Africa in Canada. Now, this is the first in an upcoming series of virtual events focusing on different issues that are affecting communities in Africa. And we want to thank you all that have taken the time to register and to actually join us today. I just want to take a quick moment on a personal note to say I want to thank everyone at Amref Health Africa in Canada for inviting me to be a part of today's event as your moderator. My heart is always with my friends in Africa. I've had the pleasure of traveling there. For me, it was Ethiopia specifically, where I had the opportunity to tour various villages and see the great advancements and improvements for healthcare and maternal care for girls and for women. My time there, so very special. In fact, cannot wait till the day comes where we are allowed to travel internationally again to make a return trip to Africa. In my time there, I was made to feel so incredibly welcome in every community that I had the pleasure to visit. And my experience really helped me have a better outlook and understanding about how to communicate about things to friends, colleagues, people that I meet. And especially to my own children. Within our own household, I think we need to share this message to family members. And what I tell my kids and my friends, my colleagues, is that we need to do three very simple things. One, look and see. Attending an event like this is a great way. Acknowledge the people and the circumstances that we're looking at. Second, ask questions, specifically very simple questions. What is needed? How can I help? How can I make a difference? And third is to take that last step and do what we can to help make the difference. And it's something anyone can do. It's what I teach my kids. Doing something, whether that is, for some it's volunteering, for others it's financial. Financial doesn't have to be huge. It can be a small financial donation. It's a great habit to get into. I've personally seen the difference that it makes. And I'm hoping that we see a lot more people doing that, especially with Christmas coming up. We can incorporate this as part of our Christmas. So again, thank you for having me as part of this event, and we'll get things going. Now, this 90-minute event will be sure to inform, to educate, and entertain you. We have a musical guest you're going to absolutely love. Her Nigerian-born singer, songwriter, actress, Sonia Aimy will be performing for us in a short while. Please let me now introduce you to Amref board member, Jeff Pentland, who's going to say a few words. Jeff?
Oh, thanks very much, Sharon. And hello, everyone. Let me join Sharon in thanking you all for joining us here today. We really appreciate your time. We're going to talk today about something that's impacted all of our lives, and that's COVID-19. Obviously, it's impacted how we socialize. It's impacted how we communicate, how we work, how we engage with our friends, with our families, with our loved ones, how we access education, and also how we access healthcare. That's true everywhere. And as we're going to hear more about today, it's certainly true on the African continent. And there are some particular challenges with respect to how COVID-19 has impacted access to healthcare for women and girls in Africa. To be honest, the pandemic has also impacted how we fundraise. And this kind of event is new to us here at Amref, but as you're going to hear, this is a really compelling cause. And it's something to which the board at Amref, I can say this on behalf of my fellow board members, we're very, very committed. And as a result of that commitment, we've agreed to match donations received in connection with today's event, dollar for dollar, up to $20,000. So really encourage you over the course of the conversation here and afterwards to please consider giving to this important cause. You can go to amrefcanada.org. We've made it pretty easy for you to donate there. And I'm really looking forward to the discussion today. So with that, let me hand things back to Sharon.
And thank you, Jeff. A great message. And you're going to be hearing us throughout this event, reminding you to share with family, with friends, share the message, because it's very important work that's going to be done. And you're going to hear a lot more about it as I turn to introducing our panelists for today. We have a wonderful panel for you. The first of our panelists is Dr. Githinji Gitahi, who is Global CEO for Amref Health Africa. Dr. Gitahi is co-chair of the UHC 2030 Steering Committee, a global World Bank and World Health Organization initiative for universal health coverage. Hello, doctor. He also serves, great to have you, also serves on the governing board of the Africa CDC and is a member of the World Health Organization's Community Health Worker Hub. Dr. Gitahi is also a member of the board of directors of the Standard Group. And Dr. Gitahi is joining us today from our global headquarters in Nairobi, Kenya. And it is wonderful to see you today. I'd also like to introduce panelist Onome Ako, who is Executive Director for Amref Health Africa in Canada. Now, Ms. Ako is responsible for leading the organization's strategic growth in Canada and innovative programming in areas which include maternal and newborn and child health, sexual reproductive health rights, adolescent health, and nutrition. And Onome brings her passion for developing strategic partnerships and placing communities at the heart of solutions to their own health challenges to achieve Amref's mandate of lasting health change in Africa. Ms. Ako is a member of the board of directors of the Canadian Partnership for Women and Children's Health, and she is joining us from Amref's Toronto office. Hello, Onome.
Hi, Sharon. Great to be here.
Great to have you. And finally, we have Margaret Kilonzo, who is joining us. Now, Margaret is a volunteer community health worker in the Kibera area of Nairobi, Kenya, which is one of the largest urban slums in Africa. Born and raised in Kibera, Ms. Kilonzo has been a frontline health worker for more than 20 years, providing essential services to her entire community. As a community health worker, she provides vital education to families about the signs and symptoms of COVID-19 and the ways to prevent its spread. It's a message we're all learning as we go, and a big part of the solution here. Ms. Kilonzo has a deep passion and commitment to the health and rights of girls and women in her community, and she is joining us today from our Amref office in Kenya. Welcome. Okay, so we are going to dive right in and get things started. And I think we'll get things started by talking to you, Dr. Gitahi. As the global CEO for Amref Health Africa, how has COVID-19 impacted girls and women in Africa in the areas of basic health and access to services?
Well, thank you very much, Sharon, and thank you to all of you for joining us here today so that we can make a difference. Your presence here tonight obviously says that you're interested in making a difference, and therefore we must thank you for that willingness to come here and help us to make the change that we need to make in Africa. Now, many people, maybe Sharon, I'll start with just explaining a little about certain understandings or misunderstandings of COVID-19 in Africa. Because I think laying down that context is important for us, even as we dive into how women and girls are affected. The first thing I would like to say is that Africa is affected by COVID-19. And whereas the media may present it as if Africa has been spared the pandemic, as I like to, I tend to see in many of the editorials, Africa has not been spared the pandemic. We may then have to define what this means when we talk about has Africa been spared or not spared. The first thing I want to say is that the pandemic first came to, from China, then there was Europe, US, and everything else, and then got to Africa around 14th of February, which I remember very clearly because it was Valentine's Day, Sharon, so I never forget that date. And when it came into Africa, people thought that it would rapidly spread and we would see people dying on the streets. That did not happen. And I think that is what informs the view of the media that Africa was spared the pandemic. Let me just tell you that the pandemic in Africa moved very quickly from being a health crisis to being a socio and economic crisis more rapidly than anywhere else across the world. And we had to move from, quickly from health to social and economic crisis. We started to see that the initial reactions of government are actually what escalated it, as was expected. It wasn't a mistake of anyone. Is what escalated it from purely a health crisis to a social and economic crisis. We saw the curfews happen. In Africa, we did not do total lockdowns. Other than a few countries like South Africa that did some minimal, limited total lockdown, many countries in sub-Saharan Africa did not do total lockdowns. And the reason for this is because 80% of our population works in the informal sector. There's a woman who needs to sell her cabbages to feed her family. There is a girl, who needs to go to school. There is a man who has a family and they need to go to their masons or plumbers. They need to go to the site where they construct buildings and they get an earning. And because of that, the government was shy to actually do total lockdowns. So it means therefore that economies were allowed to continue to work, but with certain restrictions. Those restrictions included one, obviously public health measures, wash your hands with soap and water, social distance. At that point, the masks were not as prevalent as they are now. At that point, the mask message was kind of mixed, but now, everyone has to wear a mask. But one of the things that was also introduced was night curfew. So other than the measures I've talked about, economies were, churches were closed, schools were closed, bars and restaurants were closed, that's all the cafes, and people were asked to work from home, but offices were not closed. Then there was the curfew that was instituted. In Kenya, it was at 7 p.m., everyone had to go home, and other countries was around the same time, Uganda and others were around the same time. Now, this is where we start to see the impact of these measures on the society and actually exacerbating the impact on already communities and populations groups that already had vulnerabilities. So when you look at pre-COVID, women and girls were already left behind. They were already left behind because there was already a disparity in education access. There was a disparity in the job market. There was a disparity in pay. There was a disparity in access to economic opportunities that were already existing. For girls, there was already a disparity in access to sexual and reproductive health commodities. There was a disparity in gender equity. All these things were there pre-existing COVID. When COVID came, it just preyed on these existing vulnerabilities and made them worse. So if you look at then what happened, let's look at basic services. So number one, if I was to start from the girls already were having challenges in Africa, accessing family planning commodities. For the sake of our audience here, whereas a young girl in Europe or North America can easily access family planning commodities, in Africa, we already have social and cultural barriers for this girl to access these commodities. You go to a clinic, and Margaret will tell us more because she's a community health worker, works closely with health centers and dispensaries, and you find that the nurse there is not willing to provide family planning commodities to girls under 18 years, and they say you are underage for family planning. So already there is a gap that's exacerbated by policy, by socio-cultural issues. So this is why many African countries are struggling with a significant burden of teenage pregnancies, which has been complicated by religion and culture and society, and also the paternalistic approach to society that men make decisions and women have to follow. And that also affects the girls. So this is one thing that has been exacerbated by COVID, that girls who need to access family planning, commodities, or even sexual and reproductive health services, advice, and counseling can no longer access that, because when COVID came, the hospitals were vacated by people because of fear of infection. Health workers cut down services. Services like sexual and reproductive health were considered elective services, not emergency. And therefore, if you needed to access family planning, that was not considered an emergency. An emergency was when you're bleeding or you had a heart attack. And all these services, including elective surgery, were not accessible anymore. So girls could not access these services, and the schools were closed. They were more exposed requirement for family planning, and they couldn't access these commodities. So this kind of made matters worse. Secondly, in Africa, access to abortion services is non-existent because of the policies and regulations that exist and socio-cultural barriers. Now you can imagine that even where some of the organizations were actually providing some of these services under the law, they could no longer provide them because they were also considered to be elective. So even where they were available for medical reasons, they could not be accessed. Then you come up now to the same girls, and you now start to talk about the fact that gender-based violence started to increase. Started to increase because the men we talked about, who are mainly the perpetrators of gender-based violence, were now at home, and they were mentally affected. There was anxiety because of loss of their jobs. We saw gender-based violence rising. And within the gender-based violence, because we work within the area of ending female genital cutting or female genital mutilation, we saw the girls at home now more prone to going back to female genital mutilation because their fathers were depressed, they're jobless. And when you take a girl for female genital mutilation, or what they call a rite of passage, then it is easier for you to sell off the girl for marriage. And when you give the girl out for marriage, then you earn cows and goats and this kind of thing. And with a depressed economy, the girl becomes a source of economic empowerment for the men. So we saw these things rising, including early child marriage. When you go to the women, because of the curfew that I talked about that starts around 7 p.m., and what happened immediately, Sharon, is we saw extreme police brutality when this happened. So anyone who was seen outside their house at 7 p.m. was clobbered to near death. And the police did not consider your needs and your circumstances for being out at 7. That created extreme fear. And we saw that women stopped to go to the facility to deliver. And what they preferred to do was deliver at home and maybe get a traditional birth attendant. And we saw home deliveries rising. We saw this going up. So what did we do? We started as Amref Health Africa to see how do we close this gap. So with other partners, we started a program we call Wheels for Life. Now, what Wheels for Life was supposed to do, we used the popular technology of taxi hailing, and we like Uber and others, and we said, let us work with taxi hailing companies as a partner. We work with the Ministry of Security as a partner, and we work with other partners, and this work with gynecologists and obstetricians and say, if a woman is pregnant and they are pregnant and they need to seek because they're getting into labor at night and they need to get out of their houses and they're afraid of the police, we provide them a line that is toll-free. They call that line and they find a set of nurses, midwives, and when they listen to their case, they then connect them to the taxi hailing company that is already approved by security agency to travel at night to pick this woman and take this woman to the facility. And we saw thousands of women calling and we saved thousands of lives and ended up with healthy mothers, healthy babies. This is just a quick wrap up of the impact, even without going to the other areas, Sharon, of the fact that women who already don't have economic activities, the few who had, they lost their jobs. They could not sell their wares in the market because the markets were closed. People are not going out. And therefore, it exacerbated the gap in economic empowerment between women and men. So this is just a wrap up of this kind of effect. And I think I'll take it back to you, Sharon.
Okay, thank you, Dr. Gitahi. And that gives us an idea. You're starting to paint a picture for us of the circumstances that are there. And now I'd like to take it to the community level because we are very fortunate to have Margaret with us to talk about this. Margaret, can you share from the local community level the experience, the perspective, and maybe some stories to give us a better idea of the impact of COVID-19 on women and girls?
Okay, thank you so much. In fact, COVID-19 brought a lot of impact. Women and girls were very much affected even up to now. For once, if I talk about women, most of them were sacked out of their jobs, which affected them psychologically because it's where they used to get their bread for every day. But now when they were sacked, everything was gone. So providing for their basic needs for their children became a very big problem. And remember, others were single mothers. So they didn't have anybody to depend on. There was also that increment of the domestic violence in their households, that gender-based violence from their husbands, because you find that most of the husbands were also sacked from their jobs and they became depressed. So there was that blame game from the husband and the wife, and you find that the women became so much depressed, even others were committing suicides. Okay, there was issue of the women, they didn't want to go to the health facilities. Reason being, they feared what the doctor said, the brutality from the police, and also the fear of contracting COVID-19 in the clinic. So most of the pregnant women preferred going to seek deliveries from the traditional birth attendants, which resorted to high mortality rate to both mothers and babies. There was also increment of HIV infection, and also they defaulted from taking their children for immunization, because for one, they thought that when they go to the clinic, they'll get COVID-19, and also they'll be taken to quarantine. So others with long-term illnesses preferred taking herbals, and others even defaulted completely medication. There was also those who preferred also herbal clinics for family planning, and they brought a lot of effects because the medicines were not working. Coming to girls, there was a high number of underage pregnancies, as I'll show you later on. You find that due to idleness and peer pressure, most of these girls became affected. They were taught to learn through online, and you find if you look at the slums, getting even the smartphone, others they don't have, there is no television in their house, even paying for the electricity is a problem. So you find that these girls were very idle, and due to peer pressure, they ended up getting pregnant. Even you find that in their homes, there was that lack of food. So they decided to get food from any resources they could. You find that others turned to be commercial sex workers, of which they ended up getting HIV infections and trying to do backstreet abortions, which ended up them getting others dying because of the abortion are not safe. There was also that increase of defilement of these young girls from their family members, even to people they really know them very well. And this has affected the girls so much. You find that even others, until today, they are really psychologically affected. And to talk about this, I have some slides which I want to show you as examples of what is going on in the community. So please, can I get the slides? Can I start with the first slide, please? Yeah, now I can explain about this one. This is a 15-year-old girl. You can see she's pregnant. She was in Form 2. She couldn't access online learning because in their house, they don't have even a television. There is no electricity, and even they don't have a smartphone. Her mother is disabled, and she doesn't do anything. She's a housewife. So this girl was very angry one day. So a man decided to take advantage of her. She just bought a fries of 20 shillings. Then he took advantage of this girl. So the girl became pregnant. After that incident, the father didn't want to see the girl, not the mother, because there was that blame game. The father was blaming the mother that she was responsible for what happened. So most of the time they were chased out. Domestic violence was very high in the house until this girl decided to do several abortions. She tried 2 abortions with detergents, but they didn't work. So until today, the girl was really affected psychologically. The mother is also affected psychologically, and also the father doesn't want to see this girl. As now we are talking, she gave birth last month, and she's there, very young, 15-year-old girl. This is because She couldn't learn through online. She couldn't even afford. And this is what's happening in the community. This is just one case of what is happening in that community. Trying to do abortion, so you don't know whether even HIV infection, because she was doing, what she did was not safe. And you can see the girl is very, very young. So the next slide. Okay, this is a lady, the baby is very much malnourished. It was, when we went for the MWAC, the baby was in the red position, which was severely malnourished. This lady decided not to take the child to the clinic because she feared the COVID-19. So the baby couldn't attend the immunization, the 9th month for measles. So even the baby herself was malnourished. So the health deteriorated slowly by slowly. As we talk now, the baby is admitted in Kenyatta, being done transfusion. Because after we referred her to the clinic, she also defaulted again. We had to follow up again and again. But the mother is still psychologically affected because of the myths in the community. In the community, there are a lot of myths that the others believe even there is no COVID-19. And some of these mothers, when they hear things like that, they react differently. But as community health workers, we are working day and night to save them. But this child was really, really affected because she was malnourished and redlined very severely. And now she also admits the immunization, the 9th month for measles. But we thank for Amref because the baby was able to get the immunization, and now they are doing those supplements. They are giving them, but as for now, the baby is admitted in Kenyatta. So that is some of the examples of what is happening in the community, which has been brought by COVID-19. And it is so bad in the community. If everything, we could come to the community and see what is happening to women and girls, is so terrible. Thank you so much.
Thank you, Margaret. And that really does bring us to ground level and paints a picture for us of what is happening. At this point, I want to turn to Onome to ask you now, from the Canadian perspective, how have Canadians reacted to these issues faced by girls and women, and what have you seen happening?
In the community, for one, there is that issue of lack of PPEs in the community, but for me, I don't know for now what is happening, how they are helped, but what I can think I can give some solution to these problems. I think we should engage these girls on online learning platform and introduce community programs on mentorship, because you find that these girls, most of the time, they lack a lot of information, of which we try to give them, but continuous counseling, I think it's very important. Also, there is issue of myths and misconceptions surrounding COVID-19, which should be really be addressed in the community. And for women, I think we should start IGS for the women to empower them economically, because in fact, they are really getting a lot of problems to feed their children, and others are single mothers. If you can see, most of the women, even buying PPEs is a problem to them because they can't afford. Yeah.
Thank you, Margaret. So Onome, how have Canadians reacted to the circumstances?
Thank you, Sharon. First of all, I'd like to say thank you to everyone that has taken time out to spend with us today. I know that there are many competing priorities, so thank you for honoring our invitation. And thank you to Githinji and to Margaret as well, because I know it's really late your time. It's almost 9 o'clock. So Sharon, to your question, let me start by recognizing the effects of COVID-19 in the lives of Canadians every day. This is the first time in my life, and I think in the life of many others on this call today, that I've experienced an emergency that is truly global. No matter where we live in the world, we're having to cope with COVID-19 in all aspects of our lives, in our family, our work, and our social lives. And it is very, very difficult. And because this pandemic is truly global, it requires global collaboration to solve it. We need to work together across borders to bring the virus under control. COVID-19 anywhere is a threat everywhere. Githinji and Margaret have both painted a really strong image of the realities and the challenges of COVID-19 in the communities we work. And these are challenges that are over and above what many of us experience here in Canada. So Sharon, to answer your question, in my conversations with Canadians, particularly our supporters, I'm hearing that Canadians care. Mm-hmm. They have expressed empathy. They're wondering, if I'm finding it so challenging here and I live in Canada, how much more challenging must it be in some of the communities where we work in Africa? For example, I can turn on my tap and expect running water, so I can wash my hands and ensure that myself and members of my family are taking one of the basic preventative steps to curbing the spread of COVID-19. This is not the case in many of the communities where we work on the continent, where families are not able to access running water or soap or have access to hand sanitizers, as we heard Margaret mention. Mm-hmm. Social distancing, impossible, because many people are living together in one small shelter. Again, Margaret mentioned the fact that the girl in the photo got pregnant because she was not able to access, learning remote, the tools for remote learning, right? She didn't have access to a phone, not to a computer, and the school authorities are not able to provide for all students. Now, add to this, we heard from Githinji as well, the loss of income, families struggling to put food on the table, yet alone pay for healthcare or masks. Now, what we know as well is that COVID-19 has not impacted everyone equally. In fact, it's been a wake-up call that has laid bare the systemic inequalities within Canada and between countries within the global community. It is the first time that many of us have a sense of the challenges that people go through in communities where we work, even without COVID-19, some of which I've mentioned, and some, a lot of which both Githinji and Margaret have also spoken about. Mm-hmm. So Canadians, are telling us that they understand. They understand that girls and women have been placed at greater risk, even here at home, because of COVID-19. Women are facing additional burdens, childcare, schooling, keeping the home going while also working. I'm a perfect example of that. I have a 4-year-old who's, schooling online, and I'm working and at this conference at the same time. We're also hearing, not hearing, but we know that there's an increased risk in partner violence because of the restrictions in movement. We heard this from Githinji, we heard this from Margaret as well. We know that women are precariously employed, and they are the majority working essential jobs. They're the front lines, they're the nurses, they're the personal support workers, they're the clerks at the grocery stores, increasing their risk of contracting and spreading the virus. Now, if I were to add to this list, in communities where we work in Africa, women and girls are facing an increased risk of harmful practices such as female genital mutilation and child marriage. In fact, data from UNFPA has told us that the pandemic will cause significant delays in programming to end female genital mutilation and child marriage, which will result in an estimated 2 million more cases of female genital mutilation and 13 million more cases of child marriage. Hear that, 2 million cases of female genital mutilation and 13 million more cases of child marriage in the next 10 years. That's really, really sobering, and we cannot afford to lose ground on the progress that we've made. So I'm hearing Canadians, talk about the world around them. It's almost like COVID-19 has, further expanded our views. We've always tended as Canadians to look, beyond Canada and to be proud of our legacy in how we engage with the global community. And we see this is even becoming stronger. There's a strong, strong sense of solidarity. And for this, we're really grateful. Sharon?
Yes, and what you've just talked about there really does emphasize a couple of things. One, that we really need to share that message because we all recognize it's a global pandemic, but sometimes I think we use the term without really fully encapsulating and understanding what that means, and that is that it's affecting everyone across the world. And as you mentioned, as difficult as many Canadians find a circumstance at home, and it is very challenging and difficult, when we look to communities in places like Africa, there are even further problems that ripple out from that initial COVID-19. I guess that COVID-19 being the virus being the pebble thrown in the water, but the ripples that go out extend so much further, and we need to be able to communicate an understanding of what that means. And Onome, as you said, how we can help as Canadians who care about our global community. Now we have a couple more minutes before we get to our entertainment, which I'm very excited to get to today. But quickly, very quickly, if I could get a brief answer from each of you to this. In your opinion, what will be the most significant changes, be that systemic or local, that will be needed to support girls and women during the COVID-19 crisis? And I think, Dr. Gitahi, can we start with you?
Yes, happy to start because I am, I have two great women here working with me on this panel. So they are the experts on this, but I like to call myself a feminist, a male ally. So I like to think a lot about what are those things we need to do. And within the COVID-19, because it's only 2 minutes for this, we'll talk a little more later about the more institutional changes. The one thing I've seen missing, Sharon, is that there has been no gender lens in the responses. Because there has been no gender lens. So if we imagine the things we are talking about, and you say the government sits down, ministers and the other people sit in a room and decide we are putting curfew at 7 p.m., period. And we are releasing police on the streets, and if you are found outside at 7 p.m., you'll be clobbered and you'll be charged. At what point did they miss the fact that for many women, labor camps at night, and the women need to go to the facility and they need to access it safely? Were there women in the room? I would guess not, because if there are women in the room, they would have said, hey, wait a minute. When I delivered my child, then I needed to go to the clinic at 11 p.m. So can we make sure that this particular policy of curfew at 7 has a rider that unless 1, 2, 3, or we are going to do this, and for pregnant women, there'll be this number that you can call. When we started this issue of closure of schools, many girls access sanitary pads from school programs that are funded by government. When schools were closed, was there no woman or youth girl or young girl in the room or young lady in the room to say, by the way, we access our sanitary pads from school. Therefore, as you close schools, transfer the sanitary pads to a community access point? Zero. So the only thing I would like to raise here to resolve this issue is that every policy must wear a gender lens.
Absolutely. Good point. Very good point. Very quickly, Margaret, what are your thoughts on significant changes, either, I guess, for you at the local level, required to support girls and women?
Okay, I think one, we should engage these girls on learning platforms, online learning, so that we can address that issue of idleness, which is bringing all these problems. And also for women, there should be a strategy put in place for pregnant women so that they can be able to visit the clinic anytime. It doesn't matter whether it is daytime or nighttime, so that because of this curfew thing, they can just visit the clinic anytime they are on labor. And also those community programs, which will be continuous, so that they can mentor these girls, so that they can know how to deal with peer pressure and the psychological depression which they have due to COVID-19. And also these mothers, in fact, they are really affected psychologically also. They should have those continuous counseling to address the issue of gender-based violence, and also that issue of being sacked out of their jobs, because for now, most of them cannot provide for their children. I think that will help, and also if we can start ideas for these women who doesn't have anything to do and empower them economically, it will do some change in the community. Thank you.
Thank you, Margaret. And Onome, would you like to add anything?
Absolutely, Sharon, very quickly, because I don't want to be between the musical interlude and us. So I think both Margaret and Githinji have really covered it from a local level. But what I will add is that at a global level, I think as Canadians, we need to continue to insist on gender equity in all policies and support countries that are committed to protecting the health and rights of women and girls. And we also need to speak out publicly when countries are violating the rights of women and girls. Sharon?
Thank you. And we will get back to our panel in a little bit, but we have been really looking forward to being able to share with you some really wonderful music. Sonia Aimy is joining us for our entertainment segment today. Now if you're not familiar with her music, I suggest you check her out as well online after this event today. She has a website, soniaaimy.com, and if you go to YouTube, lots of great videos there. She's a singer, a songwriter, an actress who ignites audiences with African world music. She's truly, truly an international performer. She has fans in Europe and Africa and here in Canada, and I'm a new fan. She is really an inspiration, not just for her musical gifts, but also for the humanitarian work she does. It's a huge part of who she is, and we are truly honored to have her here today to entertain us. So now, on behalf of all of us, we are truly pleased to present Sonia Aimy.
Oh, thank you so much, Amref Health Africa, for having me to sing a couple of songs to support this event. During these difficult times we are passing through. It is inspiring to see organizations such as Amref still active in, especially in response to the issues in Africa, where they have been so much silenced all this while. So really, I'm really humbled. Just a couple of songs, Sandra, which reflects the story of human trafficking and prostitution. And I have been wondering during this COVID time, what about those women who are being trafficked, victims of human trafficking and prostitution? And what a better platform to showcase a song like this. Sandra tiene no feeling anywhere. I got plenty of dreams for a better life. He changed my name to suit a new life. Now I'm Sandra everywhere I go. I got a new look, a new hairstyle. I got on my pants to walk alone. Every word I speak belong to him. Every step I take belong to him. Out there on the street, in the coldest nights, against my wish, I'll tell me Sandra, against my wish, he called me Sandra. I'm winning man, I'll tell me Sandra, he changed my name, I'll tell me Sandra. Dohamume, Domamume, Omakae. He changed my name to suit a new life. I must be Sandra when I'm on the road. I got no peace, I got no dreams. Just got on my heels and walk along. Every word I speak belong to him. Every step I take belong to him. Out there on the street, through the widest nights, against my wish, oh, tell me, Sandra, I'm winning man. Oh, tell me, Sandra, Sandra. Sandra. This is woman, Mwanamuke in Kiswahili. A woman is a box of life. She fits everyone's demand. Be a brother, sister, be a lover, just a friend. Every puzzle she gets solved, a resolution to your feet. Mwanamke gets along, no matter what's going on. She's got a strength that gives you hope, a wisdom to lead your path, a woman's courage to get along. No matter what she's going through, she's a woman. She is the strength. She is the courage. She is Mwanamke. Mwanamke. Mwanamke, respect a woman. Mwanamke, care for a woman. Mwanamke, love a woman. Mwanamke, respect a woman. Mwanamke, care for her. Mwanamke, love, love, love her. Mwanamke, respect a woman. Mwanamke, careful, she brings life. Mwanam careful, she brings light. Mwanam care love. Mwanam care love. Mwanam care respect, respect a woman. Mwanam care mwanamke, oh woman, mwanamke, love a woman, mwanamke, care for a woman, mwanamke, support a woman, mwanamke. Oh, thank you so much.
Madeline, you can go ahead.
Thank you. Good afternoon. Such compelling testimonials from our expert panelists. And Sonia, what a voice. Thank you very much. Thank you again from all of us board members at Amref Health Africa in Canada for being a part of our fundraising event. I want to take this opportunity to remind you that our board members will match donations dollar for dollar up to $20,000. So please donate, donate, donate to our fundraiser today. It only takes a few minutes. Thank you again for joining us. Sharon, over to you.
And thank you so much, Madeleine. And again, I want to echo what you said was, wow, Sonia, that was absolutely beautiful, fabulous music. And I want to remind everyone that soniaaimy.com, she's got a great website and you can investigate further into her music because it is absolutely wonderful. And I want to welcome everyone back for the remainder of our panel discussion. Our topic today, of course, the impact of COVID-19 in Africa on the women and girls in the area of basic health, access to services as well. And we want to turn our attention to now in the second segment to the response that is needed, because that's where we can all play a part. We're going to start this segment though with Margaret, because as a result of COVID-19, the situation that has been mentioned already today, the government introduced a 10 o'clock curfew in Kenya. So Margaret, we need to get her in because she needs to leave our discussion shortly after she speaks in order to comply. So Margaret, as a local volunteer community health worker, can you speak to the urgency of the response that we need for women and girls given the current situation and post-pandemic? Do we have Margaret?
Yes, thank you so much. I think it is very urgent because the mortality rate, especially to women and children, is increasing because of lack of the essential services. So I think urgent intervention is really needed to save the situation of women and girls, especially pregnant mothers. And you can see about the girls and also that urgency in order to avoid these unwanted pregnancies. I think there is a need of very urgent intervention, in fact, to save these girls from all these problems. Thank you so much.
Okay, thank you. And as you head out to comply with the curfew, please be safe and thank you for joining us today.
Thank you so much. Bye, everyone.
Bye. I'd like to turn over the speaking now to Dr. Gitahi. Now, from that larger African lens, what kind of response do you see that is needed, be that systematic or otherwise, to make a difference, and not just a difference now, but a lasting impact for women and girls in Africa?
Thank you very much. Maybe if I could, let me see whether I can share a slide here just to explain the situation. I think that we already talked about, so let me see. Yes. So allow me to just share this. This is, the credit to this graphic is to be given to the Bill and Melinda Gates Goalkeepers Report, which they do annually, and which I contributed to last year. And in the same report I contributed to, there was this graphic on gender gap. So a girl and a boy in an African country, in Sub-Saharan Africa, are born equal. And in fact, in many ways, as you go along, from my own training in medicine, many boys die before 5 years. So the mortality rate for boys is higher than girls. So they start off with more girls surviving. But then when you end up somewhere around here, just before school, you see what happens. You start to see the gender gap start. It doesn't start at birth. It starts somewhere just before school, actually as they go to school. And generally speaking, girls on average will end up with 2 fewer years of schooling in Sub-Saharan Africa than boys. What that means is that as you go along, somewhere around 12 years, 13 years, you start to get early child marriages or early marriage. And 21% are married before their 18th birthday. Boys don't get married. They keep going, they keep going, they keep marching on. So the gap continues to expand. And therefore, as the girls get married and have their children early, I would just like to remind you that in some of the communities in Africa, like in Kenya, in Ethiopia, in Tanzania, we are working in Guinea, in the Burkina Faso, and all these places. Other than early child marriage, they practice female genital cutting. And this is a method of suppression of women where, because they get circumcised or mutilated early, their genitals get mutilated early, they end up getting married. The purpose of the genital mutilation is actually to marry them off. And because they get married without education because of that gap, they then end up with more unpaid work because now they have to take care of their children consistently, and they continue to decline in terms of the gap, and then they have less opportunity in life, generally in the workforce, with 26% gap in the workforce, and 3 times more time spent on unpaid care work. And this care work would be taking care of children at home as their husbands and their, the male partners go out for economic opportunities, fetching water, taking care of sick children. Women are the ones who take children for immunization and delivering children. So there are all these things, and therefore those create that gap I'm showing you. Now, let me explain now why I'm showing you this, this gender gap. It is because if you look at that gender gap, you can tell that women have no problem that needs to be fixed. Girls have no problem that need to be fixed. Women and girls do not need fixing. So then we ask ourselves then, what do we need to do, Sharon, to answer this question of what is the larger thing we need to do to emancipate women and girls in Africa? Because we realize that women and men are equal and there is no fixing needed for women, then therefore we must fix the system. And therefore we have to fix the system, and fixing the system means that we have to remove barriers. Removing barriers for women is the most important thing to do to actually create a lasting impact for girls and women. Number one, I've just shown you that the gap starts at education. So the question we ask ourselves is, why is it that not as many girls as boys register for primary school education? When you look at primary school education, the gap between girls and boys and girls is actually very small. Very few communities, culturally and socially, resist taking girls to school. So that happens, but the gap is very small. But the gap goes higher when you're now transitioning from primary to secondary. Then we ask ourselves, why is the transition rate for girls lower than the transition rate for boys when you're going to higher learning? It is because of FGM. It is because of early child marriage. It is because of girls getting pregnant before they're of age, and therefore they get out of school. Many of you may remember a few years ago when the Tanzania president made a declaration saying, when a girl gets pregnant in school, they're not allowed to go back to school. But the boy who made the girl pregnant, if it was the boy, or the man who made the girl pregnant, continue with their livelihood. But the girl drops out of school and not allowed to go back. That's a barrier that must be removed, because the problem is not the girl, the problem is the barrier. What's the other barrier? The fact that girls cannot make a choice about their own bodies because they cannot access family planning, because whereas in many African countries, we have policies that say clearly that access to family planning is a right, that girls, even without an age limit, can actually access family planning services. And those services include counseling and include sex education in school. But the churches, through socio-cultural barriers, have actually created a barrier of access for the girls. And therefore the girls, because they can access counseling, cannot access family planning commodities, including condoms or contraception and long-term contraception, they therefore get pregnant. And when they get pregnant, they drop out of school. But the boys continue marching on, as I've shown you in that chart. That's a barrier that we must address. We don't need to fix the girl. You know, we tend to focus on the girl and say we need to talk to the girl, not to have underage sex and not do this and this. What barrier do we need to? We need to fix the barrier of access to sexual reproductive health services. We need to, which then affects education access. When you go along, then you start to see that there are laws actually across the world and even in Africa that allow women not to access economic opportunities. There are laws that say, by the way, if you're a woman, you can do this. And I think, you know, I looked, this is a problem we have across the world. I'm told probably up to 160 constitutions have one or two laws that actually are barrier to women development or barrier to women emancipation. Because they will say, if for you to get a visa to travel, you need consent of your husband. For you to get a passport as a woman, you need the consent of your husband. These are the barriers, Sharon, that we need to focus on, all the way from girls to women, because girls and women have no problem we need to fix. We need to fix the system.
And
thank you.
As you're watching things, as organizations like Amref Health Africa and others are addressing these issues, I know the issues are still there and they're still monumental, but are you beginning to see, or have you seen over time, a gradual change beginning to happen?
Yes, we have a gradual change. One of the things I should have mentioned is that women leadership is central to embedding these institutional changes, because women understand, they have the context, they understand the issues. So when you talk about these barriers, you know, I have been asked when I talked about barriers to girls or even talk about girl empowerment, and boys have asked me, what about us? What's the problem? And I told them, you know, when you start getting pregnant, please come back to me and we'll have that conversation. Because ideally they don't understand. But when you put women in leadership, they understand these issues. So women getting in leadership. So we are seeing improvement in women leadership. We are seeing countries that are actually promoting, you know, there are women leaders in cabinet, there are women leaders in organizations. In our own organization, by the way, I can tell you that out of the senior leadership team, that's a global senior leadership team that I have, 6 or 7% of them are women, including Onome. So this is great change that is happening, not only in our organization, but other organizations as well. So women leadership in management, in directorships, in boards, in government, because then that brings the gender lens I talked about earlier. The next thing we are seeing is that we are seeing constitutions changing so that we can achieve gender equity. We are seeing constitutions changing to demand equal representation in parliament. And remember this, that we are not talking about, we are talking about equality, but where women are left behind, we are talking about equity. We are talking about the fact that you must first remove the barriers for you to say now, We want equal policies. That's why even in some of the governments, we are changing constitution to say you must have at least 50% women and change the law to allow the women to get to parliament. It's not enough to say they did not campaign. It's not enough to say they were not enough on the ballot. It's not enough to say that they didn't win. The only thing you can do is remove the barriers and use equity, meaning those left behind become first. We are seeing change, Sharon, and that change is going to be sustainable and long-lasting.
Very good. And so, Onome, this is where I think we're hearing about that change is happening, but a lot more change needs to happen. And so speaking to someone like me, a Canadian, you know, speaking to Canadians who want to help make a difference, can you take it from there? What can we do? What do we need to do? What do we need to learn?
Absolutely, Sharon. Thanks for the question. It's a great question. I think Canadians are continually engaging in support of our work and activities in response to COVID-19, or even beyond that, in just the activities that Amref Health Africa does, as Githinji has mentioned. But of course, the need is great and we can always do more. You heard from Margaret as well that community health workers during COVID-19 probably do not have enough masks, or they don't have personal protective equipment to respond to COVID-19. So I see three things that Canadians can do. One, talk, write, email your elected officials. Canada has already announced financial support to respond to COVID-19 beyond our borders as part of global aid. Our elected officials need to know that Canadians support this decision. We need to, we need to let them know that as Canadians, we want our government, we want Canada to have a role in responding to COVID-19 outside our borders. Like I said previously, COVID-19 anywhere is a threat everywhere. I think importantly as well, as Githinji has mentioned, is the word equity, ensuring that all our policies have an equity lens. And we can see that as well through the Feminist International Assistance Policy of the Canadian government. So we really need to, encourage Canadians to encourage the governments to continue with such policies. Two, involve your friends and family at a safe distance, of course. Talk to them about what you've learned here today. Share the work that Amref Health Africa is doing on your social media feeds, on your Twitter, Facebook, Instagram, LinkedIn, or whatever your social platform of choice is. And finally, the third thing is, there's no surprise, is to donate. That's why we're having this event today. Together with you, we can do so much more. With your support today, we're looking to raise about $50,000. And our board members have already mentioned that, they can match up to $20,000 for dollar. Your financial support will assist us to provide masks, PPEs to community health workers so that they can continue to safely deliver essential health services to women and girls in their communities. We saw from the photos that Margaret showed to us, we saw the work that she's doing within her community. She's been doing this for 20 years, and there's so many more community health workers like her that need our support. We'll use funds to train community health workers and safely educate people about COVID-19 to help reduce the spread. As Canadians, we are known globally for our compassion and our belief in human rights and the value that we place on healthcare. This is a collective opportunity to answer this call for help. Tell your family and tell your friends. Let's do our part to strengthen a fragile health system with access to services and basic healthcare beyond COVID-19. We heard from Margaret, we heard from Githinji. These problems exist beyond COVID-19. So we invite you to be a part of this journey, to be part of the solution with us today and in the days and weeks that follow, to reach out a helping hand to women and girls that need your support. And Sharon, what better time of year than now, the season of giving? And I see that you're already in the giving season with your background.
I am, and I don't know about you, but I know in discussions with other friends of mine, there is a real move heart-wise toward the true meaning of the season this year. I'm finding a lot of people talking more about less buying presents to wrap up and more, little bit of that and more giving to others, which is really what the season is all about. So this is a wonderful time to be delivering this message and expressing the need, because when I find Canadians, when we know there's a need, we take care of it, generally speaking. And I think that you've all done a great job of sharing that message. There is a need and we can help. And we are getting close to the end of our fundraising event for today, but at this point, I'd like to bring in our board chair, Renee Baudouin, for a few words. Renee?
Thanks, Sharon. And thank you so much for doing this. Your time and commitment to Africa is great, and we appreciate it. Thank you. From all the Amref board members, our staff here in Canada, around the world, we thank you for attending today, and hopefully you heard our stories and our requests for help and for donations, and that will encourage you to come to our website and donate. As a board, we're committed to the success of Amref Health Africa in Canada. Please take us up on our matching offer. It will help many girls and women in all of those stories that you heard about today. Visit amrefcanada.org for more info about this event or the organization. You can donate until the end of the year. It's not just today. You can donate at any time, but for this event, it will go up to the end of the year. Tell a friend, tell a family member, become a monthly donor. This is a great help to us. And we need your help. Dr. Githinji here and his organization, they're doing amazing work in Africa on the ground, helping Africans, women and girls, and we need your help. So we thank you very much and have a wonderful afternoon. And Sharon, back to you.
Thank you so much, Renee. And I also want to again echo the thank you to Dr. Gitahi, to Onome Ako, and also to Margaret Kilonzo, who did have to go because of the curfew, but for all of your participation and sharing of the message today. I think that that's going to go a long way. I want to, for everyone who's joined us and is online with us today, I want to challenge you, as I echo the same sentiment, everyone you speak to today and in the couple of days ahead, talk about this event. Talk about what you learned. Tell them about Amref Health Africa in Canada, and share on your social media. Social media reaches so many people. And sometimes just seeing that something that one day that someone's on there and goes, oh, look at this, and that gets shared. Again, in the spirit of the season, this is the time that I think people are very receptive to hearing messages like this, and just people hearing that, people taking a hold of that, people taking that next step and taking action. All of this is going toward a greater good and making the world a much better place. So I challenge everyone to share that message. So at this time, I want to thank you all so much. From all of us, please stay safe, stay well as we manage our way through these exceptional and challenging times. Have a great day, and we'll see you again.
There's something I would like to say, Sharon, if you don't mind.
Certainly.
I'm sorry to break protocol here, but I would like to answer a question that has been asked by Doris Hamilton, which is a really critical question. I know we don't have time. And the question is, can I mention something about challenges around respecting cultures and traditions while removing barriers? And I think it's a really critical question. So allow me 2 minutes to respond to that question. To just say that that's the advantage of having an organization like Amref Health Africa that is actually African based on the ground. 95% of all our staff, we have about 1,500 staff, by the way, are African, and they're in Africa working in their communities. And our approach is never to deliver a solution outside in. Our approach is always to work with the communities to deliver the solutions inside out. So we work with the communities when we want to break barriers. We are with the community and we co-create the solution so that we navigate around respecting the community cultures. And that is what we are doing with the alternative rite of passage to end FGM in Kenya, Ethiopia, Tanzania, now moving to West Africa. We always respect cultures, and we are only able to do that because we are not coming from elsewhere in. We are already in. Thank you very much to all of you, and back to you, Sharon.
Thank you so much. And I think that's a great point to end our presentation today on. So to everyone, all the best. Have a great day. Thank you for your continued support, and please do share. Until next time, thank you.